Many patients affected by COVID-19 will need hospitalization and even care within intensive care units. Often they have weakened hearts and lungs, lost muscle, as well as effects on their mental health and cognition. For many, they'll continue recovery at Sunnybrook's St. John's Rehab.
COVID affects the body in multiple ways. So you just don't have the stamina that you had before.
Dr. Robinson says at St. John's Rehab, patients receive care from a diverse team of experts. But even for those recovering from COVID-19 at home, there are important things they should be doing. Because muscle strength and endurance can drop off quickly after prolonged bed rest, Dr. Robinson says movement is key.
Walk around the home more, start to go upstairs, do more functional activities. Even just doing exercises in bed can be helpful.
In fact, new research co-authored by Dr. Robinson finds starting rehab efforts early, even in the intensive care unit, can have a big impact on recovery. Occupational therapist Elaine Chan agrees that getting moving is a centerpiece of care. She and the team at St. John's Rehab develop a unique care plan for each patient, depending on how COVID-19 has affected their ability to do daily tasks.
It's individual. For a lot of the patients that I saw in the beginning, a lot of them were lacking endurance. And then building strength, definitely.
She says endurance building exercises like walking have been helpful with a gradual build-up over time. Other activities include chair push-ups, leg lifts, foot and calf raises, and squeezing a stress ball. Simple finger touches rebuild coordination. Chan says don't forget that aids like a leg lifter or shoehorn can help with daily activities like getting out of bed and putting on footwear when feeling weak. As well, tracking limitations will help direct efforts.
You know, even getting out of a chair is a problem. Then there's certain exercises we can work on, such as squats or, pushing off the chair and things like that to help strengthen the arms and strengthen the legs.
Dr. Robinson says being consistent with efforts to rebuild strength and endurance is critical. While patients recovering from COVID-19 are typically at St. John's Rehab for 2 to 3 weeks, it could take them and others months before getting back to feeling closer to themselves again. For anyone recovering at home and needing expert care, Chan says to reach out to your family doctor to discuss a referral. Programs like St. John's Rehab are increasing their virtual outreach, meaning many more patients can now receive care from the safety and comforts of home. With Sunnyview, I'm Monica Mattis.